Accord. Community assessment, resources for pregnant opiate users. There is an increase in opiate misuse, and more specifically, an increase in opiate abuse in pregnant women. Measuring the amount of pregnant women using opiates can be difficult, but 1 in 5 are picking up opiate prescriptions, but that does not tell us how many women are getting opiates off the street. This is an important issue because when women use opiates during pregnancy, the baby is more likely to need more hospitalization and have withdrawal symptoms. Efforts are being made already to decrease the prescription of opiates, but there is still an opioid epidemic. Also, some services, like methadone, have been found to be effective in decreasing the hospitalization for the babies. The community assessment was conducted to address the potential barriers to treatment that opiate-using pregnant women might face. For data collection, 3 interviews were completed telephonically. The clinics were Kodak, the Wellbeing Institute, and the Behavioral Awareness Center, Incorporated. I interviewed a nurse, a behavioral health tech, and a director. 2 clinics reported 300 clients, and 1 had 800. All reported that the averages of men and women are about the same, and each reported relatively low numbers of pregnant women. The numbers were 2, 3, and 25 for pregnant women receiving services. The qualifications for each are a history of opiate abuse and recent opiate use. 2 clinics reported clients can come in on a walk-in basis, and 1 reported that walk-ins are okay unless they're on state Medicaid, and then a referral is needed from a behavioral health agency. All reported about 24 to 48 hours to begin treatment services after an intake is completed. Relapse is high in the beginning of treatment services, and length of treatment for a client is on a case-by-case basis from a couple of months to a couple of years. The clinics reported external factors as being challenging for the population, these being synthetic opiates that are available on the street, transportation issues, scheduling issues due to having jobs and the hours of the clinic, and a strength for the population is wanting to quit opiate use. Kodak specifically had more treatment options available. They had methadone, Suboxone, naltrexone, or Vivitrol, primary care services, case management, and therapy services. The others offered Suboxone or Subutex and counseling. Some clinics were called multiple times and multiple messages were left, and still nothing was heard from them. Some just refused to answer questions and wouldn't even tell me how to refer a client to their services. This could be a barrier for pregnant women trying to receive treatment services from them. Clinics need to be more accessible, so answering phones and questions. Some clinics were only open for a few hours early in the morning, which can make them less accessible. People need more education about the available treatment options in the community. Also, affordable options are important because some clinics are private pay only, which can get very expensive. The plan for sharing findings is to summarize the key findings as well as the recommendations that were offered and email that to the interview participants. Already having some connections with other clinics because of past referrals helped with making the assessment successful. Another thing that made it successful was already going into the interview with some knowledge about the clinic. But it was challenging because some clinics did not want to participate. Next time, it might be beneficial to show up in person because it might make the clinic more willing to participate in the interview. A lot was learned from this first community assessment. More was learned about the available treatment options, for example, Subutex. I assume that methadone was the only treatment because that's what most research was about, but I learned that pregnant women can actually go to a Suboxone clinic and get Subutex, and that would be safe for the unborn fetus. And the rest are my references. Thank you and have a nice day.